Hi, my name is Nurse Choma. I'm going to be talking with you today about the Patho level. Like, what does this mean? Well, first and foremost, if you've already completed our free NCLEX predictor test, then you're already familiar with this term. But one of the things I like to do differently is I like to help break down how you need to really prepare for your exam based on your comprehension of different levels. So the reason why some people struggle to pass is because there's a specific level that they are weaker in than others, and it's influencing how they study the content. It's influencing how they answer practice questions. So the key in order to be successful when it comes to preparing for your exam is to identify what is the level that you're on. What's that level? And then once you figure out what that level is, then begin to take steps it takes steps towards mastering that particular level. So the first level is called the Patho level. The Patho level has to do with your ability to comprehend and to understand pathophysiology. And pathophysiology is really focused on um, understanding how the disease comes into formation, how it manifests, understanding the cellular level, fluid electrolyte balances. So that's what we're going to talk about first and foremost. We're going to start off and we're going to talk about what is the stem behind fluid and electrolyte imbalances. And really it comes down to something called osmosis. Right? So it comes down to something called osmosis. Osmosis is the movement of water molecules through a selectively permeable membrane from higher water concentration to a lower water concentration or down a concentration gradient. So water likes to move in the direction where there's more solute. Write that statement down. Water likes to move in the direction where there's more solute. It's important that you understand this basic concept because it's going to help you to better understand conditions such as SIADH, hypertension, renal failure, um, hyperkalemia. It will better help you to understand those types of illnesses and conditions and why you would expect signs and symptoms, dehydration. So this is why you need to understand basics like this. So remember, water always likes to go where there's more salt. Okay, where there's more solute, where there's more particles, that's the way that water likes to respond. So when it comes to osmosis, we have something called isotonic, hypotonic, and hypertonic. So iso means the same, right? So if you look at the picture over here on the left side, this is referring to the extracellular fluid has the same osmolarity as the cell. So meaning that there's no movement from the water in or out of the cell. So water is not moving in or out, it's just at the same. It's pretty much the same. So that's why if you look at this picture, the blue represents the water and the red represents solute. So in this situation, you see how the arrows are pointing in both directions? Because it's isotonic. Now with hypertonic, which is over here, this means greater than to the cell. So water is moving outside the cell to the region of higher solute concentration. Okay, so what's pretty much happening here is that there's more solute in the, I'm looking at the wrong one. Hypertonic is over here. So over here, there's more solute outside of the cell with hypertonic. So because there's more solute outside the cell, that's why the water is leaving the cell and the cell is shrinking. You see that? Remember, water likes to travel in the direction of where there's more solute. So in this situation, that's what water is doing. It's pretty much moving and traveling to where there's more solute, which is outside the cell. So that's a hypertonic solution. Hypotonic is in the middle right here. So with hypotonic, that means hypo meaning less than, right, than to the cell. And there's a net flow of water will be into the cell. So with here, there's more solute in the cell. See all the red here? Okay. So there's more solute that's inside the cell. So what water is doing? Water is now traveling in the cell. So this is causing the cell to swell, to get nice and plump and big, right? So so pretty much this is what it looks like. We have hypertonic where it's shrinking because it's traveling outside where there's more solute. We have isotonic where there's an even balance between in and out. And we have hypotonic where there's more solute in, and as a result, the cell is swelling. And see how right here is trying to show you that this is swelling because it burst. So when it comes, so here's how you look at it from the NCLEX perspective or from nursing perspective. When it comes to patient care, based on their diagnosis, we want to evaluate which direction is water moving on the cellular level, because this is what's going to determine how we need to respond to them or what kind of symptoms we can expect from them. You see that? So when you understand the movement of where the water is going, not only will you know, okay, what symptoms to expect, but also you know how to treat it. You know, like for example, with hypotonic, you're not going to want to give a whole bunch more fluid, right? Because it's already swelling. So we don't want to add more fluid. You see that? So it helps you to better understand patient care. So let me show you the picture one more time. All right, hyper, iso, and hypo. And let me give you an example of this. Okay, so for example, patients who have high blood pressure, right? The reason why most patients have high blood pressure is because what? They're taking in a lot of salt, right? They're ingesting large amounts of salt, and this is resulting in high sodium concentration in the bloodstream. So what's happened is that, remember, because water likes to travel in the direction of more salt, this in turn is causing water to enter the blood vessels by osmosis. And more water in the blood means a greater volume of liquid and therefore higher blood pressure. So remember, with high blood pressure, there's more salt particles in the vessels. So as a result, water is staying in the blood vessels. And because water is staying in the blood vessels, that's why the blood volume, like over here, that's what the blood volume is increased. That's why it is constricted, right? And that's what's causing the blood pressure to go up. You see that? So because I understand that, then I think, okay, the treatment then is to not administer more fluids. This is why patients who have high blood pressure, we want to encourage them to decrease their fluid intake. We want to encourage them to decrease their salt intake. So this is helping you to better understand the symptoms and the treatment. In the same regard, patients who came back from surgery, right? Patients who came back from surgery, they have normally. So think about a patient that came back from surgery. What happened to them? Well, before they went to the surgery, what do? We put them NPO, nothing by mouth, which means that they didn't get to eat or drink anything for at least 8 hours or more. So they lost fluids that way. Then they went to the surgery, and in the surgery, the doctor did some type of incision, and they probably lost some blood as well. So when they're coming back from the surgery, so you want to keep in mind that this is why there's going to be fewer solutes in their bloodstream, right? Because they lost electrolytes, right? And so that's why these patients, when they're coming back from surgery, their blood pressure tends to be lower. You see that? So that's why we would normally give lactated Ringer's solution, which is isotonic. And we're going to give this, that's why we would give lactated Ringer's, because it's an isotonic solution. Remember how we talked about earlier between isotonic, hypotonic, and hypertonic? So we want to give them the isotonic, which is LR, in order to give a good maintenance. Because what we want to do with the isotonic is we want there to be an evenness, right? We want to replenish them with more electrolytes, but at the same time, though, we don't want to overwhelm their system with too much fluid. Otherwise, what will happen? It will burst, or it will shrink too much, which is really bad. So that's why when they come back, remember when they come back for surgery, most of the time, because of the anesthesia, they're throwing up, they're vomiting, you know. So this is the reason why we're going to be treating them in this way. This is the reason why we're going to give them the LR. This is why you would expect certain things. So you see how just by better understanding osmosis, this one main concept, how much it influences your ability to understand diagnoses such as this. Not just because this is why you want to get out of the habit of memorizing stuff. Because if you've been spending all day going through a book, reading the book, and then forgetting what you're reading, then there's a problem. There's the issue is that you need to develop your understanding of concepts through the pathophysiology. And that's pretty much what I'm showing you right now. Okay, so I hope that you found this helpful. I want you to join me tomorrow for video lesson number 2. All right, video number 2. In the meantime, if you have not already, make sure you complete your free exam. Okay, make sure you complete the free test, which is our free NCLEX predictor test over at freetest.choosingnursing.net. freetest.choosingnursing.net. Go ahead and take that right now if you have not taken it yet. This will, like I said, when you take the test will actually help you to identify what is the level you're weak in. Is it the patho level? Is it content level? That's what we're going to go over tomorrow. Tomorrow we're going to talk about content level and what that means. So it will help you to identify what is your weak level. And then when you go through the video lesson, it will help you to realize, what areas you need to focus on in order to prepare for your exam. So I will see you tomorrow. So watch the video tomorrow. Check your email. Make sure you don't miss the lesson tomorrow. It will only be available for a limited time. All right, so I'll talk to you later. Have a wonderful day.